Hello. My name is Jones, and today we are going to look at the first part of our counseling course, and that is to do with acronyms that are used in counseling. Apart from that, we are also going to look at some of the concepts that are used in counseling. Okay, so we have a lot of acronyms that are used in counseling. We'll just try to choose a few, okay, that you need to familiarize yourself with as a counselor or psychosocial counselor for HIV. Okay, so people can be counselors for different crises that people face, but here my concentration is some of the acronyms that you can that you need to familiarize yourself with if you are a psychosocial counselor for HIV and AIDS. So we have AFASS, that is AFAS. Okay, this acronym means affordable, feasible, acceptable, sustainable, and safe. Okay, so that is it for AFAS. And then the acronym AIDS, we might have come across it. AIDS is acquired immune deficiency syndrome, which is the end stage of HIV, where someone may suffer from a syndrome of diseases. Then we have ART, that is antiretroviral therapy. Okay, so that is antiretroviral therapy. So that is ART. Then when we say ARVs, these are antiretroviral drugs. So when we say ARVs, we are necessarily referring to antiretroviral drugs. Okay, then let's say I happen to use terms like GIT, that is gastrointestinal tract. If we also use the term HAART, that is HAART, that is highly active antiretroviral therapy. So that is for HAART. Okay, so these terms, please, you need to familiarize yourself as a psychosocial counselor in an HIV AIDS clinic or at the HIV AIDS center. Okay, so HBC is for home-based care, and then HIV stands for human immune deficiency virus. Okay, then we have IRIS, that is IR. IRIS, this necessarily means immune response inflammatory syndrome. Okay, it is seen when you start a treatment and then the immune system of an individual start to fight those diseases that have been there. So the person tends to become sick when they have just started treatment because of this reconstitution of the immune system. So IRIS, immune response inflammatory syndrome. Then MTCT, that is mother to child transmission. Okay, mother to child transmission refers to mother to child transmission of HIV from mother to baby. So okay, so other terminologies that we also need to familiarize ourselves with is OC, that is contraceptives, oral contraceptives, and then OIs, that is opportunistic infection. These are infections that necessarily come into place when one has HIV and the immune system has been compromised. Hence, infections take an opportunity to infect an individual. So they take this opportunity because the immunity is low. So we call them opportunistic infection. Then PCR, that is polymerase chain reaction, which is taken mostly as confirmatory test in HIV and AIDS. Then PLWHA, that is people living with HIV AIDS. Then PMTCT, okay, that is prevention of mother to child transmission of HIV. Though for me, I like it so much to say we need to have what we call prevention of parent HIV from parent prevention of HIV, because when you talk of prevention of mother to child transmission, it's necessarily targeting the mother, but Also, the other parent, that is the father, should also be involved in this prevention, because there can be reinfection. So, for the sake of these acronyms, we have PMTCT, which is necessarily prevention of mother-to-child transmission of HIV. And then STI, that is sexually transmitted infections, sexually transmitted infection, STI. Okay, so we can also talk of WHO, which is World Health Organization, and then the licensing body for counseling in Zambia is ZCC, okay, which is Zambia Counselling Council. Okay, it helps to guide on the curriculum for a lot of certificate programs or programs in counseling. Okay, so to begin with this lesson, these are some of the acronyms that we can find in our each and every day counseling. So counseling is a relatively new diverse field which has been defined differently by various scholars. So it is important that we understand some of these acronyms that are used, and then we also understand the concept of counseling as psychosocial counselor. So this then suffices to say that the definition given by various scholars are usually in line with the needs that are to be met at that particular time. So people will come with a definition that necessarily fits their program on what necessarily counseling necessarily means for them, or what necessarily counseling means within their field. Otherwise, counseling, like all other fields of psychology, hinges on issues of how people thrive and about how things go wrong for people. Okay, and also competing paradigms for how to work with people for their healing and growth. Growth is also considered. Okay, so each of these perspectives of counseling generate a set of techniques, a way of working that is consistent with that particular perspective. So for the purpose of our comprehensive discourse in counseling, we considered counseling as a relationship which involves a care provider and a patient, whose objective is to assist the patient cope with a stressful situation and be able to make an assertive decision. So in our discussion in psychosocial counseling, we are considering this definition as the most appropriate definition for counseling. We have a therapeutic relationship in which communication is used as therapy to remedy the problem that the person is having. So we are saying we consider counseling in psychosocial counseling, okay, to have the objective to assist the patient cope with a stressful situation and also being able to make an assertive decision. So in support with this definition, Brana and Shatton 2002 defined counseling as one-to-one relationship between counselor and client, which focuses on rational planning, problem solving, decision making, and situational pressures as they relate to clients' daily living. Okay, so these are the two definitions that I would want us to go by when talking about psychosocial counseling. This paper focuses, this discussion necessarily focuses on the concept of counseling, the description, and the advantages of counseling and testing for HIV. Theories of counseling, therapeutic relationship, counseling process with a bias towards the implication of HIV test results, the pre-test counseling, post-test counseling, crisis counseling, group counseling, also couple counseling, and preventive counseling. So our discussion in counseling for this introductory part of our course is necessarily focusing on the concept of counseling. Also, we are looking at the description and the advantages of counseling. And also, we are looking at the testing for HIV theories that are there in counseling, therapeutic relationship that exist in counseling as you help those that come to you for aid. We are also looking at post-test counseling, crisis counseling, group counseling, couple counseling, and also preventive counseling, okay, in our study for psychosocial counseling. Okay, so I have to note that practical counseling skills and roles and also responsibility of the counselors are needed in order to help in preventive counseling, to help in group counseling, couple counseling, okay, and post-test counseling. Okay, so the synopsis of this discussion has been given as a way to include within this presentation or within this course. It should be noted that the thrust of this discussion is that counseling relates to issues of HIV and AIDS in most instances where people are offering counseling. But you need to appreciate the fact that counseling is not necessarily for HIV AIDS issues. Counseling can be for a lot of issues other than HIV. There are a lot of people that face crisis, financial crisis, that may need counseling. There are people that face a developmental crisis that need counseling. So counseling can be used in all these areas, and what is needed is that a person who is offering counseling should read widely on problems or many problems that people face, and they may seek counseling. We talk about couple counseling is because when something goes wrong within the couple, they will need counseling so that their relationship is made intact and avoid either premarital sex or sex out of marriage. Okay, so this is to safeguard the lives of the couple and preventing the spread of HIV and AIDS. So, all to say, here we are saying counseling is required for a lot of things, but our concentration here is to do with the HIV within our psychosocial counseling course. Okay, so now let us look at some of the concepts of counseling. Okay, so counseling, being a method of guidance of an individual, helps the client to grow to a greater maturity by allowing the individual to take responsibilities and to make their own decisions. As a concept, counseling is embedded on the following four aspects. These aspects are relationship, behavior, new methods, and also we can look at it to do with counseling, also developing, helping to develop a set of goals. So these aspects embedded in counseling. When we say relationship, counseling is a relationship between two people where one person attempts to assist the other to organize himself or herself better to attain a form of happiness by adjusting to the situation. Then when we say the aspect of behavior is embedded in counseling, this is because the relationship that should exist between the counselor and the client or the person being counseled should help should help the person that is being counseled to freely discuss the problem that they are facing. This in itself assists the counselor to increase the skills, courage, and self-confidence in the client, and it brings out a new behavior in the client away from their problem, and also improves the way they deal with the problem. Then the other aspect that is embedded in counseling is that new methods which can turn out to be possible solutions for the perceived problems being faced by the client can easily be found. Although in isolated cases, the client may not find a solution, but the thought of having the opportunity to share the problem with another person itself can inadvertently give satisfaction, okay, to the client. Okay, so when we are counseling someone, we do not directly give advice that they need to do ABC, but we simply propose the possible solutions for the clients to choose from, okay, so that the client can take responsibility of the choices that you as a counselor try to offer to the client as the solutions to their problems. So counseling helps an individual that needs counseling to have new methods of dealing with their problems. So this aspect is embedded in counseling. Then counseling also, the fourth aspect is that it helps aid or develop a set of goals for future behavior for the client. So in case in future the client faces a similar problem, they will have a way of dealing with this problem because they would have learned new method from the counselor on how to deal with this problem. A counselor who is well exposed is going to learn of a lot of methods of how people have dealt with their problems in the past and can simply share such methods to this one. So it is going to help those that seek counseling to develop a new set of goals for handling future challenges. Okay, so there you have it. Today we're having an introduction course in counseling. We started by looking at some of the acronyms that are used in counseling, okay, and we have emphasized that in psychosocial counseling here, that is our main concentration is HIV. Okay, so counseling can be used for a lot of problems that people face in, let's say, couples, financial crisis, employment crisis that they may have. So counseling can still be used in all these areas other than the issue of HIV and AIDS. Okay, counseling can also be done for people with diabetes on the disease process so that they understand, people with hypertension. So counseling is necessarily a course that helps people in a lot of ways. And then after that, we have looked at concepts of counseling, or concepts that are embedded in counseling. So we have discussed 4 concepts here that are embedded in counseling. The first one was to do with the relationship that exists between the counselor and the counselee. The counselor, the person that is counseling, and counselee, the person that is being counseled. Then behaviors here. Our main goal, or one of the main goals of counseling, is to help the patients to adapt, so they may tend to adopt new behaviors in trying to deal with their problem. Then the other aspect that is embedded in counseling is that new methods can be developed on how to deal with the problem. And then counseling also aids the clients to come up with the new goals in achieving their objectives in their everyday life in case they face a similar problem. Okay, so that is our lesson for today. So from me, I'm saying look forward to the next lesson, where we will look at the description and advantages of counseling and testing for HIV. So that will be our next topic in line. So from me, I'm saying thank you very much and keep studying.